this is the new normal. We don't see each other. And webinars are sometimes very difficult because while we are in the comfort of our homes, there are times technology does not cooperate with us. No? So in the period of pandemic, many things have changed. Most importantly, the economy of our country that strongly affected the marginal and financial challenge segment of our society. So, um, during this time when people lost their job, walang trabaho, the peace and order situation of the country is also threatened. Pag walang makakain, tataas ang crime rates. Dadami ang hold up, dadami ang kidnap, dadami ang nakawan. No? So that's one of the changes that we appreciate in this time of COVID. Okay, our children, they're enrolled in schools, but they end up using internet facilities in their homes. What about those without internet connection? What about those who lives in remote areas where internet connection is weak? What about those students or families that cannot afford to buy a laptop? Okay. So most people also lost their jobs. And workplace, stores, and some office, they closed and could no longer sustain the salaries of their employees. The overseas contract workers, the OFWs are back. They also lost their jobs, but just to come home without any job waiting for them. A good number of frontliners, because of fear, exhaustion, and because of low income and lack of privileges, and because of their psychological and emotional overlay,
Leba ka na.
they decide to
Sayang
resign.
ng oras.
I know some of them learned to bake, to cook at home, and do even TikTok. The hospitals are places that drew fear rather than a place to seek help for our health. Inside the hospital, the usual friendly greetings no longer exist. Kasi bago kayo pumasok, di ba, you have to answer a lot of questions and fill up papers and a thermometer waiting to greet you. People don't even recognize your face, even your friends, because with your PPEs, you all look alike. Because you have to maintain a distance, you cannot even do shake hands. You cannot hug, you cannot kiss. The nice smell of your favorite perfume is now replaced by alcohol and sanitizers. Gone are the travels. Ako, gustong gusto ko yan. And also gone are the recreation outside the home. Eto, gone are the shopping. Gone are the parties and even going to church. The only thing left is the relationship that each one of us should continue to strengthen. The opportunity and the time to bond with the family and to reflect on the more essential things in life. Most importantly, giving God our time. So while the pandemic painted a gloomy picture of a worldly life, cancer is just as bad. It is a disease that continues to increase in incidence, and it has even landed the number three as the cause of mortality and morbidity. Dati hindi nakikita sa top 10 yung cancer. Ngayon, number three na siya as cause of death and illness. Not all cancer ends with a cure. We all know that. The most common reasons are: one, they may not be diagnosed early. There's no access to facilities or money to finance treatment. Some were deprived of education and awareness for better understanding of the disease. Now, also, we do not know how to take care of ourselves. We cannot put a stop on our vices. We do not want to see the doctors for early diagnosis. We prefer treatments without the benefit of research and clinical trials. We are not conscious with our lifestyles and what we eat. We choose to live in an unclean environment, or simply because we inherited the bad gene from our ancestors. No? So in this time of pandemic, let's not lose sight as cancer needs to be treated as well. No? Not because may COVID, hindi na tayo magpapagamot. Not going for your treatment will make things worse. It will allow the cancer to grow fast, to multiply fast, spread, and eventually to kill. So the management of cancer and treatment of cancer evolves in the changing time. Ito isa sa mga field na masyadong dynamic. No? There are newer treatments with better terms in terms of survival rates and disease-free period. And they're even better in terms of their side effects or toxicities. So with COVID-19, the strategies and treatments have also changed. They were tailor-made for the most vulnerable subgroup of the population who appear to have an increased risk of extreme morbidity and mortality. And this includes patients of advancing age, male gender, those with comorbidities such as hypertension, chronic lung disease, diabetes, and cancer. They are not only at risk of contracting the infection, but they also run the risk of having more severe disease course with a higher proportion requiring higher levels of intensive care, having a more rapidly evolving disease, and with increased risk of death. No? However, cancer encompasses a myriad of diseases with diverse array of primary tumor subtypes and stages affecting patients of all ages. Kaya iba-iba ang kanilang prognosis, iba-iba ang kanilang outcome, kasi iba-iba ang kanilang stage, iba-iba sila. The treatment of cancer includes the following: surgery, and systemic treatment, such as chemo, target treatment, hormonal therapy, and immunotherapy. Cancer patients should be given a multidisciplinary management, no? Where all doctors collectively discuss the best care for the patient in the context of the COVID pandemic. So here are some of our strategies that we use in this time of pandemic. No? Okay, let me remind you that the cancer treatment is always individualized, no? Because there are no two patients that are alike. Treatment should always be tailor-made to the kind of patient you have. So using a structured method of relying on a diverse panel of experts here and abroad, we have developed a detailed set of clinical statements or guidelines for healthcare professionals to assist them in overcoming many of the clinical and technical obstacles related to the diagnosis of cancer, risk assessment, response assessment, planning the surgery, radiation, or minimal treatment. Okay, so here are some of our strategies now. Okay, number one, yan, telehealth and digital health oncology. Yan, katulad ng ginagawa ko po araw-araw dito lang sa bahay. Kausap ko yung patient, nagfe-FaceTime, nagba-Viber, and discussing their options of treatment, discussing their problems, and managing some of their symptoms. No? So telehealth and digital health in oncology, this is a real-time video consultation for triage, intervention such as counseling, prescribing of medications, management of long-term treatment, post-discharge coordination, supported by remote monitoring capabilities, wellness intervention, health education, lahat na, physical activity, diet monitoring, health risk assessment, medication adherence, and cognitive fitness. Believe it or not, I would have patients calling me for psychological support because during the lockdown, it gave them more chance to see each other at home. The more they see each other, they have more issues to fight about. No? So, however, those patients with complex cancer needs at kailangan makita ng doktor, kailangan makapa ng doktor, they should be considered for face-to-face consultation. Okay? All right, number 2, cancer care prioritization and cancer care intensity should be adapted to the pandemic scenarios. So when feasible, the context of available resources, cancer patients requiring admission for treatment should be tested first for COVID. Ayan. Testing tayo ng COVID. We do not want to infect the facilities in the hospital, di ba? So, kailangan mag-COVID. You would see that people undergoing radiation, bago mag-umpisa yung radiation, kailangan may COVID testing yan. Bago operahan, kailangan may COVID testing yan. Even those undergoing chemotherapy, kailangan may COVID testing din yan. Okay? It is for the purpose of protecting the doctors and other people inside the treatment room as well as the facilities in the hospital and at the same time protecting the patients. Kasi pag nag-chemo, lalong lalala at lalong magiging mas extreme ang mga effects ng COVID. Why? Because chemotherapy will always reduce immunity. Okay. So aside from that, we do thorough review of clinical, epidemiological, and travel history, including signs and symptoms. No? So halimbawa, tatanungin natin, saan ka sa Pilipinas galing? Halimbawa, Cebu. You know that Cebu is also mataas din ang incidence ng COVID doon. So, makakatulong yon. Second, galing ba kayo ng China? Galing ba kayo ng US? So you'll have to look into the travel history as COVID. Paano ba napunta ang COVID sa Pilipinas? It is by travel. Ba? Alright, signs and symptoms. Alam na natin ang mga signs and symptoms ng COVID. So fever alone will make us suspect. Will not eliminate COVID as one of our diagnoses. Why? Because we are in a period of pandemic. Okay. Makakita lang ng abnormality sa x-ray, hindi ka lulusot. Isa pa rin ang COVID sa mga differential diagnosis. Ubo, sipon, naku, hindi rin tayo lulusot dyan kasi symptoms din yan ng COVID. So, with all those symptoms, COVID will be the number one differential diagnosis and therefore a testing has to be done. No? So, halimbawa, if chest x-ray findings look suspicious, you will have your doctor request you to be isolated and the swab test has to be done. And if it comes out to be negative, then the patient can be transferred to a regular room. Next, PPEs. Okay, PPE stands for Personal Protective Equipment. And this includes your mask, face shield, your goggles, your gloves, anything that will protect us. Okay, PPEs in the hospital should be provided to all healthcare professionals and it should be used meticulously. Hindi tinatanggal po yung mask. Kaya po ang hirap ng mga doktor kasi kahit na makate yung ilong, hindi po natin makakamot yun. Hindi po natin dapat tinatanggal yan pag kakain. You have to eat separately. Hindi kami, we cannot join each other in our meals. Okay. Isa yon sa mga paraan bakit nagkakaroon ng COVID ang mga healthcare workers because they eat together, they take out their mask in the hospital at any time. Okay. So yun, if we are not conscious with how we use our PPEs, it will not work at our favor. No? So working in an enclosed space, you have to wear eye protection such as goggles, no? And gown, all right, and mask. Tandaan natin, pag umuwi tayo sa bahay, we are potentially pwede nating madala din yung virus kung saan natin sila nakuha sa trabaho. Okay. Usually, the mask that we use in the hospital is preferably the filtering face piece or the FFP. Ito yung tinatawag nating N95. No? And practice hand hygiene or protection such as using gloves. No? Swab tests should be offered to all symptomatic health professionals or anyone else. Basta symptomatic, kailangan swab test po. In the hospital where I work, we do swabbing regularly. Okay. It's a routine thing that every 3 weeks we need to swab. Why? Because we are working in the battlefield. No? Now, antibody testing or yung tinatawag natin rapid testing should not replace testing for SARS-CoV nucleic acid, which is what the swab test is. So between the two, ang sinasabi ko lang, hindi reliable ang rapid testing or antibody testing. Kasi yung mga patients that are asymptomatic, patients who have minimal symptoms will not produce detectable antibodies in their test. Okay. So, ang importante yung ma-identify mismo natin ang SARS-CoV-2 nucleic acid, which is only in a swab test. Kaya marami tayong mga COVID incidents ngayon kasi maraming false negative ang ating mga rapid testing. Negative nga, pero pag sinwab, they turn positive. So patients' infectivity for SARS-CoV-2 is determined by the presence of the virus in the different body fluids, such as secretions and excreta. For patients with risk of febrile neutropenia, pag nagkikimo kami, one of the most common complication is the drop in the WBC because the chemotherapy causes bone marrow suppression. Yung bulalo po natin ang nagpo-produce ng red cells, white cells, and platelets. So, in the presence of chemo, nasusuppress po ang production nun. Lalong-lalo na po ang WBC. The white blood cells, they are the ones responsible for protecting us from infection. So, takot ako pag bumabagsak niyan because my patients will be susceptible in contracting any infection for that matter. Especially now, COVID, no? So, ang tawag natin doon is neutropenia, pagbagsak ng WBC. So, for patients with risk of neutropenia secondary to chemotherapy, we give a bakuna or what we call a subcutaneous injection of GCSF prophylactically. Okay, GCSF means granulocyte colony stimulating factor. This is the injection that clones for WBC in a period of 24 hours. Patataasin niya kaagad yung WBC. So pag alam ng doktor na makaharm yung patient sa chemo, pwedeng prophylactically magbigay ng GCSF. But in patients with solid tumors not treated with curative intent, consider giving equally effective treatment unlikely to induce neutropenia. So, hindi lang naman chemo ang pwedeng ibigay na treatment for cancer. So, consider giving an alternative that will not cause neutropenia, kung pwede, no? So, in patients with cancer and COVID-19, there is an increased risk. Okay, this is neutropenia, pagbagsak ng WBC. Now, for those patients with cancer and COVID-19, pareho sila na nagkukos ng risk ng thromboembolic events. Yung pagbara sa mga blood vessels. And therefore, giving of blood thinners or any anticoagulants prophylactically is also suggested. Okay. For indications of neoadjuvant treatment, now, when we say neoadjuvant chemotherapy, it is the chemo given before surgery, okay, for the purpose of decreasing the size, downstaging the disease, so that the tumor can easily be resected. We call that neoadjuvant. But when we say adjuvant, that is giving chemotherapy after surgery. Okay? Why do we do that? Kahit na wala ng gross disease, it is to run after the microscopic cancer cells that might have been left after surgery. And this could be the cause of early recurrence and early spread in the future. No? So, for the indication of neoadjuvant treatment or adjuvant treatment, if there is survival benefit, never delay the treatment. So kahit na may COVID, huwag kayong matatakot kasi kung survival benefit ang pinag-uusapan at mataas yon, you have to go for your chemo. However, if patient tested positive for COVID, never give chemotherapy. You postpone the treatment until recovery. Okay? So active and progressing status of cancer, advanced age, poor fitness, smoking status. These are all comorbidities, no? And adding chemotherapy will increase the risk for severity and mortality of COVID-19. Okay? So for patients with COVID, ICU transfer is considered in patients only if there is a reasonable life expectancy and it has become the highest priority. No? So kung makikita natin na reversible lahat, give the patient the benefit of an ICU. We all know in the hospital, yung pinakakonting beds ay nasa ICU. No? And iilan lang yon, even in the biggest hospital in the country. Kokonti lang yung ating ICU. Okay. Now, deviation from the clinical protocols may be considered. No? So sa pagkikimo namin, di ba, it's given every cycle and one cycle is every 21 days. At this time of pandemic, pwede nang gawing 28 days. Okay. Next, yung mga siniswero na chemotherapy, baka pwede nang i-convert to oral yung mga tablet equivalents. No? Or even converting weekly treatment to an every 21 to 28 day cycle. Why? For less exposure of our patients to the hospital. And for those undergoing radiotherapy, pwede namang iklian. Okay, you can abbreviate or shorten radiotherapy. And for those needing surgery, it should be done with necessary precautions as not to compromise the oncological prognosis of the patient. But if the surgery is an emergency, it has to be. an emergency. Now, for those tumors, no, that are early stage tumors, no, alternative non-surgical approach may be considered. So, what I have mentioned are just ways by which we manage cancer patients without compromising their much needed treatment at this time of pandemic. So, lastly, I would like to ask you to ask yourselves, did you really want to go back to the old normal? Yan, magandang tanong, no? Did you really want to go back to the old normal? Okay. I would like to end my lecture by sharing you my thoughts and perspective. This is my personal perspective of the pandemic. Okay. Life was busy for me before the pandemic. I work in 3 hospitals. I leave the house at 8 o'clock in the morning. I come home late at night, as late as 12 midnight or even 1 o'clock in the morning. So when I get home, I'm just too tired. The only thing I want to do is rest and sleep. Because of exhaustion, I could not even complete my conversation with God, no? As my eyes were too heavy and I would fall asleep. Next day is the same story. Now I praise God that the my time with Him on Sundays are still met. But many times, my Sundays are shared by emergency calls, rounds in the hospital, answering referrals, and even doing unscheduled cleaning. I also look forward to my travels because most of them are related with my CNEs. So it is not only a venue for learning, but maybe a time out to rest, make lakwatsa, do some shopping. Okay? Many times I will bargain with the Lord to allow me to buy a new bag again and again and again, and a new pair of shoes that goes with the bag, and some nice clothes that I cannot even use now. Shopping became a vice, and spending money was just an initial guilt, as this has become really habitual. So I had my days when I was running the biggest institute in our hospital as an institute director. Praise God, I'm no longer one. No? And because I chose to function the best I could, the stress I received converted to physical illness. So now I am hypertensive. My asthma that doesn't act up for a long time has been acting up frequently. And I turned diabetic as I forgot to eat properly, eat on time, and to do my exercises. My daily routine robbed me of my time with God. But God was patient with me and did not allow me to continue with my selfish way. So aside from my physical illness, He allowed me to have the heart that grew empty and unhappy. So kahit na ako nagtatrabaho, kumikita, ay hindi masaya. So it made me search for someone to fill the void. He came into my life. He was intense. I allowed him to rule my heart that it was easy to forget position, possession, and the many idols I had in my life. So I asked him to replace everything with a ministry where I can feel him moment by moment. So God provided me the groups and showed me the best book that got all the dust on the shelf. And that's how he communicates with me, his word in the Bible. So this pandemic He gave me a different perspective that made me see the best in his plans. No? He wanted me to live simply. Wala nang bags, wala nang shoes, hindi na magamit. He kept me locked up in the house, protecting me from the harm of the environment, as he knows I have all the comorbids. My earnings were low, but I held on to his promise that he will provide my needs and not my wants. He gave me opportunities to practice generosity with even a low earning, as I decided to maintain the salaries of my secretaries, the driver that doesn't drive anymore, the maids that don't work. And he gave me the time to do exercise. O, di ba? Zumba every night, no? And look, now my BP is very much normal. He made me see the clear sky. He made me see healing differently. Alam niya na ang buhay sa hospital tuwing may nawawala, malungkot. Pero he gave me a different perspective of death. He said that dying is healing as well, as their lives are happier with him, with no pains and no more illness. So he made me realize that relationships are more important. And most of all, he answered my prayer when I asked for a spiritual ministry. I have pulled my patients. Most of them are here right now. Hello?
Hello
The
po.
support groups that we have, the Anchor of Hope and the Corridor of Hope, they are here in the Zoom. Sila po yung patuloy na nag-inspire sa akin. We pulled all together our resources just to continuously learn about God. We study His Word, we feel His presence as we continue to share Him with others. If I remember right, I think I started with 4 people sharing God's Word, and now they're almost hitting 40. And each Zoomer brings another Zoomer. Believe it or not, the classes is 3 times a week. The Bible class that we have is conducted Tuesday, Thursday, and Saturday. And it's all about God's grace, no? So God has taught me in this time of pandemic simplicity, patience, and continuously He revealed His attributes through His Word. And all I want is to keep pursuing Him and live my purpose. So I can now answer the question I posted. Each day He has brought changes in my life, and I would like to live another normal in His presence while I continue to enjoy my walk with Him. So I hope as we part ways, you will ask yourselves, do you want to go back to the old normal? Okay? I think that ends my sharing.
Thank you,
Thank you
Dr.
so much.
Charity.
Thank you so much.